Hi, my name is Dr. Doug Pooley, and I'm with C.A.R.E Chiropractic and Acupuncture. What I want to talk to you a bit about today is about arthritis and spinal arthritis. And the reason why I want to do this is because I think that there's a lot of miscommunication and misconception out in the public's eye about how important arthritis is to the creation of pain. What I want to assure you is that there are certain circumstances, for example, disease conditions such as psoriatic arthritis or rheumatoid arthritis, or other disease entities, which can certainly create pain in the body and most notably in the spine. But I want to assure you that even though we've been led to believe that arthritis is a cause of pain, in fact, arthritis as we know it, not osteoarthritis or degenerative joint disease, in itself is not a cause of pain. Arthritis, the spine, let me first start with the spine. The spine is a wonderfully designed structure. It has evolved literally over hundreds of thousands of years. What it does with the skull is it creates a solid casement for what's the most important part of the human body, and that's the neurological system. So it's evolved in such a way to be not only strong and stable, but also supportive. Science has shown that even though arthritis, as we know it, is essentially a logical conclusion of life in general. I mean, if you're hanging around this world long enough, you're certainly going to develop some levels of arthritic change. That arthritis in itself is not, in most cases, a cause of discomfort with the low back. Even though that we've been led to believe that there's medications that are for arthritic pain, the arthritis itself does not cause pain. The arthritis is a reaction to other what's called biomechanical dysfunction. And what that means in plain English is the arthritis is the nature's way of attempting to stabilize an area that has become unstable. And it's this instability that actually causes the discomfort. Because what it does is it stirs up the underlying tissues, creating inflammation. It's the inflammation that puts pressure on nerves, and it's that discomfort, the nerve pain, that gives you the pain that's often associated with arthritis. Now, evidence of arthritis on an x-ray is valuable because what it does is it tells the healthcare practitioner that here is an area of biomechanical instability. So, if you really want to effectively deal with your arthritic change, especially when it comes to the spine, the taking of analgesics can be a benefit to you in the short term because what it deals with is a lot of the inflammation and the discomfort. But if you limit it to that, you're doing yourself, I believe, a horrible disservice. Because in actuality, by not tending to the mechanical concern, whether it be an area of instability associated with postural problems, muscular weakness, damage that's been associated with previous injury, if these areas are not dealt with effectively, and often the treatment of pain associated with arthritis is nothing more than getting the area stabilized and then giving the patient, empowering the patient by giving them the exercises that are appropriate to create strength and therefore stability, and in doing that, reduce the irritation and inflammation in the affected area. So please don't let anybody tell you when it comes to spinal arthritis that your arthritis is a source of pain. It's not. There are very few nerve endings in areas of arthritis, whether it be deterioration at the joint surface or whether it be spurring in association with areas of weakness. The pain is coming as a result of the mechanical instability. So by correcting the mechanical instability, often even in patients with exceptional levels of arthritis, the pain can be reduced significantly and mobility improved. So analgesics, good for short term. Correction, better for long term. Thanks.